Well, I'm a general ophthalmologist, and I perform a number of lasers, including all the ones you mentioned. Currently, I'm performing about 4 to 5 SLTs a week, as well as about 4 to 5 YAGs, and then a scattering of iridotomies and retina procedures, including focal grids and PRPs, as well as laser retinopexies. Well, I'm offering the SLT as a primary therapy, and I'm finding that about 25% of the SLTs that I'm doing are now primary therapies, as opposed to starting a prostaglandin analog. I do about 25% adjunct and about 50% replacement if the patient's on one medication. The Lumenis SLT gives me another weapon in my armamentarium to treat glaucoma. Before I had the SLT available, I primarily treated glaucoma either medically with drops. And now this is an alternative to that. And I've been able to get a lot of people off of their prostaglandin analogs using the SLT, and it helps me with compliance issues and that type of thing. We all have those non-compliant patients that we know aren't taking their drops, and this is a great way to ensure that they're getting the proper pressure lowering. I find that my patients really appreciate not having to have the $70 copay that goes along with having prostaglandin analogs, and this is a way that I can help reduce their dependence on those medications. The thing I like most about having the trio is that it's all in one unit, and so I have the capability to do SLT lasers, YAGs, as well as argon lasers all in one piece of equipment, and it has a very small footprint, and that's nice at my ASC where we don't have a lot of room. The thing I value the most from Lumenis is a functional product, and we actually had some other lasers in our surgery center that didn't work. They were non-functional, and so the great thing about Lumenis is if you buy a Lumenis laser, it works. It does what it's supposed to do. The repeatability of the SLT was an important factor in us deciding to purchase the laser. I have a ophthalmology-specific ambulatory surgery center. We have 6 ophthalmologists, and we debated the merits of SLT versus some of the other laser therapies that were out there. The data on the repeatability definitely allowed us to help make the decision to purchase the SLT. The SLT laser to doing the ALT procedure, I find that it's much easier to tolerate for the patients, as well as it's an easier, technically easier procedure to perform as a physician. My Lumenis rep has been very easy to work with. He's been available if we've ever had any trouble. I've actually called him on the weekend several times when I was in to do an emergency surgery and was having difficulty setting up the laser, and he answered his phone and was able to walk me through procedures, and he's been very approachable and easy to work with. When we bought the trio laser, I found out that the reimbursement on the SLT is basically paid for the entire laser. I would absolutely recommend the trio laser. I find it very easy to work with. I really enjoy being able to do SLT and be able to offer that to my patients. It's a fabulous YAG laser. It works every time. It's very easy to use, and I find that the argon functions are just spectacular and do a great job. I've used other lasers in the past, and this is the best one that I've used. I've talked to some of my ophthalmology colleagues about the SLT, and they were considering whether they're bringing it in or not. I would say that it's pretty much a no-brainer. It's if you're treating glaucoma patients, then it's nice to be able to offer that to your patients. Anyone who's considering purchasing the Lumenis SLT, I'd say go for it. It's worked great in our hands. We've had a good return on our investment, and we've had lots of very happy and satisfied patients.